Hello, everyone. My name is Paula Neves, and I'm the lead for the Center for Living Organ Donation. I'd like to welcome you to today's webinar on drug-induced liver injuries. We're very, very fortunate to have colleagues from Halifax join us today for a very, very interesting presentation and also for questions and answers. We know that many of you have submitted questions in advance, and we will be addressing those at the end of our session. I would like to introduce Dr. Julie Zhu, who is a hepatologist and a gastroenterologist at Dalhousie University and the Atlantic Canada Liver Transplant Program. Dr. Zhu will be joined by Dr. Larry James and Josh Millard, who are colleagues at the Atlantic Canada Liver Transplant Program as well. As usual, you may submit your questions during this presentation by going to slido.com and putting in code hepatitis. That's slido.com hepatitis. I would now like to invite Dr. Julie Zhu to introduce her colleagues and to go through her presentation. Dr. Zhu?
Thank you, Paula. Thank you, Courtney. Hello, everyone. Thanks for coming to today's webinar on drug-induced liver injury. I'm here, I'm Dr. Zhu. I'm here with my colleague, Dr. James, a fellow in GI from Dalhousie University, and Josh, who is a transplant coordinator at the post-liver transplant clinic in Halifax. So today's topic is on drug-induced liver injury. I have no disclosures. Today's webinar will be divided into questions and answers. Will be divided into different sections. You will also be able to ask some questions after the presentation online. So Dr. Larry James, would you be able to ask the first question?
Sure. Good afternoon, Dr. Zhu. There are a lot of common questions that are being asked. The first one we have is, how common is drug-induced liver injury?
Thank you. It is very common. There are many prescription and over-the-counter drugs through many mechanisms and can give rise to drug-induced liver injury. And in terms of epidemiology, there are about 10 to 15 per 1,000 to 100,000 persons exposed to prescription medications and will develop drug-induced liver injury. And so approximately 10% of all cases of acute hepatitis will be caused by DILI, drug-induced liver injury. It is the most common cause of acute liver failure in the United States and Canada. It is also the most frequently cited reason for a withdrawal of a medication from the market. As mentioned before, many DILIs are missed during clinical trials. And so for each case of abnormal liver enzymes seen at clinical trials, about 10% of them will actually impact a patient's liver enzymes when these drugs become available in the future. These patients may have significant abnormality in their liver enzymes, such as ALT greater than 10 times upper limit norm. There are a few factors, risk factors associated with development of DILI, one being age. So adults are more likely to have DILI than children, and also women are more susceptible than men just because of their size are smaller on average, as well as alcohol use disorder and malnutrition all dispose DILI in some cases, and as well as genetics is being studied as well. There are over 1,000 medications and herbal products that have been implicated in the development of DILI, and the list continues to grow. And as more and more new drugs are developed and available every few years. The National Institutes of Health has maintained a searchable database of drugs, herbal medications, and dietary supplements that are associated with DILI, and the website will be provided to you at the end of the presentation. In terms of the top 2 drugs associated with DILI, the most common one in acute DILI is in the United States and Canada is acetaminophen, also known as Tylenol, followed by Augmentin, also known as amoxicillin clavulanate acid. And most common ones are either Tylenol or antibiotics. Amoxiclav is one of the most common reported causes of DILI. Here shown are the pictures of both. So acetaminophen is the classic examples of what we call dose-dependent acute liver injury. And it is predictable and dose-dependent. Where most patients will recover, about 1% may progress into acute liver failure and in need of a liver transplant. Unfortunately, this happens more often than not of acetaminophen-associated drug-induced liver injury or overdose, and about more than 60,000 overdoses are reported in the United States per year. It's one of the most, it's one of the leading causes of acute liver failure in North America. And each transplant center has at least one case like this.
Is there another type of drug-induced liver injury that's not dose-dependent?
Very good question. So yes, there is a second type, which is idiosyncratic DILI. This type is not dose-dependent. It is very unpredictable. There are many drugs that are infrequently associated with this type of hepatic toxicity, and the list is very long. And question number 3, Dr. James?
It's something that everybody would like to know. What are the signs and symptoms of drug-induced liver injury?
Another fantastic question. DILI is considered acute if liver tests have been abnormal for less than 3 months, and chronic if they've been abnormal for more than 3 months. So most cases, the acute presentations include mild symptoms. Most patients are actually asymptomatic, but with if you check their liver enzymes, they're abnormal. When they have symptoms, they may develop pruritus, look jaundiced with acute illness and cholestasis that may resemble viral hepatitis, or and about 1% of them will suffer from acute liver failure. Many patients with DILI are asymptomatic, as mentioned before, only detected because of abnormal liver tests. The symptoms are, other symptoms could be malaise, low-grade fever, anorexia, nausea, vomiting, right upper quadrant pain, jaundice, and acolic stool, so pale stool and dark urine. And the chronic symptoms can mimic other causes of chronic liver disease. And so with chronic DILI, they may go on to develop significant fibrosis or cirrhosis and have signs and symptoms associated with that, and hepatic decompensation, such as jaundice, ascites, and pulmonary erythema. You can see a picture of pulmonary erythema here. And question number 4.
Dr. Zhu, how does one diagnose drug-induced liver injury?
Very good question again. So it's normally diagnosed by blood test if the patient is asymptomatic. And with hepatocellular injury, a patient will have disproportionately elevated transaminases, aminotransferases. And the patient with a cholestatic injury will predominantly have elevation of their alkaline phosphatase. And in the case of acute hepatocellular injury, the elevation of aminotransferases can be markedly abnormal, like more than 25 times of upper limit norm. And serum bilirubin may also be elevated, as well as iron, which is a marker of coagulopathy and synthetic liver dysfunction and liver injury. So DILI can be diagnosed, is only diagnosed by exclusion of other liver diseases, and it's very important to exclude hepatitis C, hepatitis B, and hepatitis E. It is very important to assess causality. Diagnosing DILI can be difficult. It depends on obtaining a careful drug use history and ruling out other potential causes of liver injury. Other than those non-specific symptoms that develops after introduction of a drug, such as malaise, anorexia, nausea, fatigue, right upper quadrant pain, or pruritus, they can indicate drug toxicity and should prompt evaluation for drug-induced liver injury. We typically do not proceed with the liver biopsy at first, but this may be done in about 40 to 50% of the patient when the diagnosis is unclear. So assessing causality is very important. There are some key elements attributing liver injury to a drug, including drug exposure preceding the onset of liver injury, underlying liver disease excluded, and stopping the drug leads to improvement of the liver injury, and rapid and severe reoccurrence may occur if there is repeated exposure with the drug. However, re-challenging is not always advised. Another factor that can support the diagnosis of DILI is hepatic injury in a setting of exposure to a drug with a history of causing DILI in other patients. This is now captured by a public available website called LiverTalks, which is updated repertoire of DILI cases associated with specific drugs. And what questions may be asked at the medical encounter to investigate DILI? Well, you may be asked to provide drug history, and this can be challenging. They would include prescribed and over-the-counter herbal and dietary supplements you may be taking in the last few weeks, or even months to years. There may be a review of your pharmacy record that may help confirm the medication that you were taking or currently taking. You may be taking multiple medications and making identification of a single offending agent difficult. You may also have a concomitant liver disease, which can produce similar clinical and laboratory features. Dr. James, we're ready for your next question.
Do I need to have a liver biopsy to make a diagnosis of the drug-induced liver injury?
Thank you. This is another very commonly asked question. So you do not always need a liver biopsy. It's sometimes done to assess cause and severity of liver injury. About half the time, you may be asked to undergo a liver biopsy. On the liver biopsy, we could see patterns of liver injury under a microscope. Some of the histological findings in patients with DILI are classic acute hepatocellular injury caused by drugs like methodopa, isoniazid, phenytoin. But they can also mimic other causes of liver disease. The histological findings are not diagnostic for a specific cause of DILI. The pattern of injury can provide clues to etiology of injury and help rule out other causes of liver injury like Wilson's disease or hemochromatosis. So acute hepatocellular injury is seen in about 90% cases of liver-related toxicity. And so that is something that we see all the time, followed by chronic hepatocellular injury. And again, there are a couple of drugs examples that are culprit for that, and such as moxiclav, atorvastatin, and methotrexate. Also, you can see acute cholestatic injury and chronic cholestatic injury. Sometimes you will see cirrhosis, steatosis, which is fat accumulation in the liver. Other times you may see something called hepatic venous flow obstruction, also known as Budd-Chiari syndrome, and veno-occlusive disease is less common. We'll finish with, is there a treatment for DILI? The primary treatment for DILI is withdrawal of the offending drug. So early recognition of drug toxicity is very important to permit assessment of severity and monitoring of acute liver failure. There are very few specific therapy that can be given that have been shown to be beneficial in clinical trials. Two exceptions are the use of N-acetylcysteine for acetaminophen toxicity and L-carnitine for valproic acid overdose. The glucocorticoids are of unproven benefit for most forms of drug hepatotoxicity.
What proportion of patients with drug-induced liver injury will need to go in for transplant?
Very good question. So that majority of patients with DILI will experience complete recovery once the offending medication is stopped. In a setting of cholestatic injury, jaundice can take weeks to months to resolve. There are some factors associated with poor prognosis, and such as deep jaundice, bilirubin greater than 2 times the upper limit norm, in a setting of abnormal ALT greater than 3 times the upper limit norm, so mixed pattern. and liver failure in children due to anti-epileptics, and liver failure due to acetaminophen that requires dialysis, as well as serum creatinine elevation, other pre-existing liver conditions. Otherwise, only 5 to 10% may progress into chronic liver disease, and in that case, they may develop cirrhosis. And the other condition we mentioned earlier is acute liver failure. And so in this population, a patient will most likely require liver transplant referral. So we'll finish with prevention here. So preventing DILI includes educating patients about taking potentially hepatotoxic drugs and their safe use, including appropriate dosing and potential interaction with other drugs or alcohol. For acetaminophen, there are over 300 products over the counter that have acetaminophen component in them. So they are also present in more than 20 prescription drugs. You may not be aware of that. You should be aware of the classic hepatotoxic medication, such as Tylenol, and learn how to read different parts of the medicine label shown here with its active ingredients, warnings, and directions. So this is the DILI website we talked about, and here is a website link to the liver talks. And this link is a repertoire of reported cases of DILI associated with specific medication is being updated regularly, and I think it will be useful for you to use in the future. And I appreciate your time, and thank you very much for attending to this presentation. Thank you, Dr. James.
Thank you very much, Dr. Zhu and Dr. James, for a very, very comprehensive presentation. I know that we have a number of questions that were submitted in advance, and our audience may also have questions as you were going through your presentations. And before we get to questions, perhaps Dr. James, you're a medical doctor, you're currently completing your residency in gastroenterology. Typically, have you seen, what are the symptoms that you're seeing patients with as they come in? Maybe we can start with you and then Dr. Zhu, just to give our audience a sense of some of the things that are important to be on the lookout for.
We do see patients in the emerge in internal medicine. They come as emergency patients to the ED, and the main symptoms that they have either jaundice or not feeling well, malaise, and they usually give history of having taken an antibiotic for some infection. The ones that we've commonly seen, as Dr. Zhu said, is amoxiclav, and Tylenol. These are the two that we commonly see in the emerge. The most important thing is to keep this in mind. So when they come in with these symptoms and they have the history of having had these antibiotics and they look jaundiced and the liver enzymes are elevated, then you know that you're dealing with probably a drug-induced liver injury.
Thank you very much, Dr. James. Dr. Zhu, how difficult is it to diagnose these patients?
It is very difficult to diagnose these patients because, as you've known from the talk and Dr. James' talk, there are many causes of jaundice and abnormal liver enzymes. So the diagnosis is exclusion of other liver disease, and really looking at the temporal relation of disease onset to exposure of a herbal or supplement, dietary supplement or prescription medication. And so I think that if we can establish that there are no other causes of abnormal liver enzymes and that you have identifiable exposure, it becomes more convincing that this is a drug-induced liver injury.
Mm-hmm. Thank you. So let's go to our questions. Obviously, there's a lot of concern about herbal supplements and protein and collagen supplements and their impact on the liver. So maybe, Dr. Zhu, can you discuss the impact of these supplements on the liver? Are there things that our audience should be on the lookout for, things to be careful about?
Absolutely. There are lots of known and unknown impacts of herbal supplements, and many are taking them to boost their immune system, to feel better. And so there are certain health benefits from taking the herbal supplements. And keep in mind that most of them are not reviewed by FDA, Health Canada, and they are purchased over the counter. So the harm on the liver is an unknown. And so it's very difficult to predict if something is going to cause drug-induced liver injury in the general population, and specifically to the person taking it, as there are many factors that could impact the drug-induced liver injury, such as genetics and your immune system and different components of the herbal medication. And keep in mind that reading the medicine label is important. At the same time that sometimes the complete ingredients are not available to us. And so they are not labeled on the medicine label. And these can be potential cause of drug-induced liver injury. So I would say that the impact, we are becoming more and more aware of their negative impacts because of our, this topic of interest. But at the same time, there is a lot that we don't know about these herbal and dietary supplements on the liver. So be very careful when you take something. If you're feeling unwell, you need to report this to your physician or nurse and have your liver enzymes checked. And most importantly, stop taking them if you have developed drug-induced liver injury from these herbal medications.
Thank you. And are there examples of herbal supplements or other types of supplements that are more problematic or that have been found to be associated with liver injury?
And absolutely. I think there is I think in the United States, they have a repertoire of the different herbal medication dietary supplements that are being reported to cause liver injury. The instances are rare, so it's difficult to predict whether or not a specific individual will have the same reaction. But the list is growing, as you have heard. And I think that if you check the Liver Talks website prior to taking some medication, you may have a good idea of what are the impacts on other people. It may help you decide whether or not you should take it.
Thank you. And Dr. James, anything that you would add with respect to supplements and to complement some of the advice that Dr. Zhu has given?
No, I think what Dr. Zhu has, I have nothing more to add.
Thank you. All right, so let's move on to our next question. I think this was addressed during your presentation, Dr. Zhu, but can you discuss the incidence of drug-induced hepatitis? How rare is it? And specifically, do we have numbers for the incidence of drug-induced hepatitis in Canada?
Yeah, that's a good question. So going back to the first few minutes of the presentation, it's found to be about 10 to 15 per 100,000 persons exposed to that prescription medication. So it's, acute hepatitis by drug-induced liver injury is about 10% of the whole, of all causes of acute hepatitis. The incidence in North America is similar to that of Europe, and however, there is a geographic variation in the incidence of drug-induced hepatitis. And so I would say that we're learning more and more about it. In terms of incidence in Canada, very similar to the United States population, and the top one remains Tylenol-induced drug toxicity. And the second one being Augmentin, and followed by a few other antibiotics. But they are very rare. If you look at how many drugs we are taking every year compared to how many people actually develop drug-induced hepatitis, it is still considered very rare.
Right. And during your presentation, I think you mentioned advising less than 2 to 4 grams of acetaminophen or other similar sort of medications. In practical terms, what is that? Is that a common sort of dosage that a lot of people would be taking, say, to manage their pain?
Yeah, so people take acetaminophen to manage their pain or fever. It's also used in children, essentially, all age groups. And it's one of the most prescribed and used over-the-counter medication. And so it's 2 to 4 grams a day is safe in terms of avoiding drug-induced liver injury. And so if someone takes more than 4 grams a day and use it more regularly, they're at risk of drug-induced liver injury. In overdose situation, the ingestion is typically greater than 8 to 9 grams. Some people still develop drug-induced injury after taking 4 to 5 grams if they have underlying liver disease or they have co-ingestion, such as with Advil use or alcohol. So I think that 2 to 4 grams is a safe margin for majority of people.
Thank you. Our next question addresses one of the treatment options for those who have serious liver injury, and that is how do you decide when somebody with drug-induced hepatitis is a candidate for liver transplant?
A very good question again. And it's hopefully they don't need one. And so most cases, they will recover from their drug-induced hepatitis, especially in the non-Tylenol setting. And so if there's someone that has acute liver failure, for example, they have developed deep jaundice and with hepatoencephalopathy, confusion, changing mental status, these are the poor prognosticators in liver transplant requirement. And so if they have had abnormal INR or abnormal bilirubin that's rising or develop renal failure, for example, they should be referred immediately to a liver transplant center, be assessed. And in terms of proportion of patients requiring liver transplant, it's still very small. It's probably about 1 to 5%. And I'm sure your transplant center has seen quite a few of them over the years. Even though it's rare, each transplant center has at least taken care of one patient with Tylenol overdose.
Mm-hmm. And what are the outcomes for these patients?
They are generally, you mean after transplant? They are generally doing quite well. Yeah, right. They generally do very well after transplant, and in Tylenol overdose cases, both the patient survival and the graft survival are excellent after 1 year, 3 years, and 5 years compared to other causes of liver disease that requires liver transplant. Of course, these patients will be on immunosuppression medication long term, but in general, they do very well and they have excellent outcome.
Thank you very much. Maybe I can address the next question to Dr. James. Dr. James, many patients take many medications for pain, for blood pressure, for arthritis. All of these medications have side effects, and some of those side effects affect the liver. And I'm wondering if you could suggest some questions that our audience could potentially ask their doctor or pharmacist to see if they might be at risk.
I think the first point is that whenever they're going in to see a physician or going into a walk-in clinic, to take a list of the medications that they're taking, because many times that may not be available to the physician who's seeing you. So that's the first thing, so that the physician seeing the patient knows what all medications are there. And when a new medication is being added, to ask the doctor specifically if this medication has any side effects. I think being very specific and asking very specific questions based on particular drugs, definitely they'll be able to get information from the physician. And the second thing is from the pharmacist, when they're getting the medications maybe a new prescription when they're getting from a pharmacist, they should ask them, does this cause any damage, any injury to my liver? And the third thing is the liver tox, the site that Dr. Zhu had mentioned. It's extremely good. It has detailed information on all medications. And now with the internet, there's no dearth of information. So whenever you're prescribed a new medication, you can just check up and it always tells you what the side effects are. So I think these are the ways that one can make sure that you're safe and not taking anything that will injure your liver.
Thank you very much. I know that, when we get new medications and we read all of the side effects, sometimes it can be very overwhelming for patients. So it is a good reminder to have a conversation with our doctor and our pharmacist just to discuss the side effects of these medications in plain language so that we understand that everything has risk, but we also are aware of symptoms and signs that we may want to be on the lookout for. So very, very important. Now, our next question, I think we've addressed, but there's a subsequent one regarding patients or persons who may have had an incident of drug-induced hepatitis. What happens with those patients? Do they have permanent scarring? And what is the likelihood of a repeated incident with a different drug or a herbal medication? So Dr. Zhu, perhaps you could address this question.
Sure. I think the drug-related hepatitis, causing scar tissue it's rare amongst people who have recovered from it. So majority recover without chronic liver disease, and about 10% of them may develop scar tissue, and that can lead to cirrhosis over time, especially if there are other risk factors of cirrhosis like fatty liver disease or other toxin exposure such as alcohol. And the likelihood of repeat incident with a different drug or herbal medication is likely low, as we don't quite understand the mechanism or the exact mechanism, the trigger of that immune response, adaptive immune response associated with drug-induced liver injury. So it's difficult to predict whether or not the same different drug may cause the same symptoms. And that being said, I think you should avoid taking the same drug again, with likelihood of drug-induced liver injury under the same drug is high. And perhaps try to avoid taking extra dietary herbal medication, and especially talk to your physician about them before you take it again.
Thank you very much. And perhaps this last question we'll direct to Dr. James. Dr. James, we know that alcohol interacts with medications and herbal supplements, often with grave consequences for the liver. Can you talk a little bit about alcohol consumption generally when on medication, and then time between taking medication and herbal supplements to avoid liver injury?
Thank you, Paula. I think my advice would be not to take alcohol. That would be my advice, especially when you're taking a new medication that could be injuring the liver. And many herbal supplements, you don't know what the components are and whether how much of injury they cause the liver. So you wouldn't know. So my advice would be actually when you're taking these medications, to avoid consuming alcohol. I think I would ask Dr. Zhu about the time when to consume alcohol in case you're taking these medications. I would leave that question to Dr. Zhu.
Thank you very much, Dr. James. Dr. Zhu? I think Dr. James answered the question very well. I would agree with him that in general, I would advise no alcohol consumption during the recovery process, because alcohol is a known liver toxin. if you have not developed any drug-induced liver injury from a medication, herbal supplements, and you should also think about reducing alcohol consumption if you're drinking it more excessively. So in general, I would say, wait at least 6 months before consuming alcohol, and wait till liver enzymes are absolutely normal, and to ensure that you've recovered completely.
Thank you. Thank you very much. And we've reached the end of the questions and the end of today's session. A reminder that we have a number of other similar events coming up next week. On Wednesday evening, we have an evening of transplant innovation, which is part of the Ajmera Transplant Center open house. On Thursday, April 22nd, we have our regular webinar series, this time with colleagues from SickKids, who will be talking about the complexity of creating a culture of transplant. And then the following Monday, we have our regular series on the COVID-19 vaccine. We will be addressing your questions and also providing additional information for transplant recipients and caregivers. So please join us for these events. You may register at our Eventbrite site or view them on our YouTube channel.